Hi, I'm Dr. Jesse Schulz. I'm a physical therapist. I work in McWanago, Wisconsin. I'm going to talk to you a little bit about posture today, which is very important for shoulder pain, neck pain, and back pain, either in the lower back or in the upper back. There's a lot of different things that are important about posture. First off, how you're setting yourself up from both the level of the foot all the way up to the head and positioning for that. So what I'm sitting in right now is a rolling computer chair, very typical for what people would have in the office. And in this sort of chair right now, I've got a high back. And if I would use this high back in this chair, you can see my upper back rounds and my head just automatically goes forward. Now, the back of this chair is locked right now. Sometimes it's loose and I would recline back even further and my head would go even further forward. What this is going to do is it's going to put a lot more pressure on your neck and on your upper back joints and muscles, which can create almost an overuse or a straining sort of a problem with those. And sometimes if someone's coming into physical therapy or a chiropractor or massage therapist for neck pain or back pain, and they're not getting better, sometimes it's that your posture is not good enough to maintain the benefits that you're getting from one of those practitioners that you may be seeing. So one of the things that I always encourage everyone to do, no matter what chair you're sitting on, is first off, make sure that you've got a good base. If your feet are on the floor, flat on the floor in front of you, it takes 30% of the body weight off your lower back, which is of course very important for if you have a lower back problem. But if your lower back is better supported, it's going to set up your upper back to be better supported, which is then going to set up your neck to be better supported as you're sitting there. So I'm going to wheel myself back again. So ideally, my feet would be flat on the floor, which you can probably just barely see right now. And in this chair, I know if I would be using the backrest in this chair, I'm going to be slouching a lot more than I want to. What happens for me at the end of the day is I go home with a headache. So I'm going to sit on the edge of this chair. My feet are still flat on the floor, and I'm going to find what I call neutral spine. And this can be done in any chair. Neutral spine is basically the position halfway in between being slouched or flexed in the low back and arched or really kind of curved backwards in the low back. We don't want to be in either one of those positions for any long period of time. But our neutral, which is going to be different for me than it is for you, is going to be an important concept where you get all those stomach and back muscles to kind of work together to protect your back and not overstrain anything. So what I'm going to do to find my neutral, I'm going to go back as far as I can comfortably, forward as far as I can comfortably, and I'm going to kind of settle myself right in the middle, which for me is right about here. Now, I've got my feet flat on the ground, I've got neutral spine for my lower back, and without changing my lower back position, I'm going to do something called a thoracic lift or a sternal lift. I'm going to put my hand for feedback on my sternum or my breastbone, and I'm just going to lift my chest just a little bit. It might not even look like much on this video, but it's probably just lifting my chest upwards as if you're kind of taking a deep breath in, maybe about a ½ inch at the most. But what this is going to do is it's going to straighten that curve in your upper back so you're not rounded more than you need to be. So I've got my lower back and my neutral spine. I've got my thoracic lift performed. And now the last part of the equation is to get my neck longer or to do an occipital lift. So for this, we're going to find the lowest part of the skull, which is right about here for me, and I'm going to try to lengthen the back of my neck slightly. And that's it. This is going to be the best posture I can have, especially if I let my shoulders go back slightly in this position. If you are working at a computer all day long, while you're maintaining this position, you want to try to keep your elbows close to your sides like this with the keyboard underneath your fingers. If you're reaching forward like this, it puts a lot more strain on your shoulders and neck. If you have a different chair than this, none of those principles should really change all that much. This sort of chair is going to be easier, and I can actually use the backrest here to support my back if my back gets tired. And that's another important thing. When you're sitting in any type of chair, your body likes to move. So even if you're in perfect posture position for an hour or two and you don't move at all, your body's not going to like that. Your discs in your spine like to move around to basically get the fluid moving in and out of the discs so that they're healthy. And your muscles also like to lengthen and shorten a little bit to basically keep them moving healthily to stabilize your spine. Some people like to use a ball like this. For me, this is a very large ball. And most people would say, wow, this ball looks very large. But the truth of the matter is, for me, this ball is perfect. It again lets me put my feet flat on the floor. My knees and hips are both bent to 90 degrees, which should be the same in any chair. I can find my neutral spine. I do my thoracic lift, and I do my occipital lift, and I'm in a good position. If I was sitting watching TV, my abdominal muscles are going to be turned on more when I'm sitting on this ball versus if I'm sitting on a solid chair. And also, if I would be working at a computer desk, I'd be getting more of my stomach muscles engaging for me as the day goes on. But many people do like using one of these balls, although I would like to make the point, it is possible to slouch while you're still sitting on these. And if you're sitting for too long a period of time and focusing on something, it's very easy to get into this position, and you're no better off than you would have been in a normal office chair or in a stationary chair. As a small addendum, I want to bring up a few other points. First off, for people that are spending a lot of time in the car driving, sometimes how your posture is in the car is very important. Depending upon your car, sometimes it's almost impossible to get into a good posture position. Now, if your car has a lumbar support, sometimes it's not going to be in the right position for you. It's going to be a little bit too big, a little bit too small. One of the things you can do is take a small towel roll, small blanket, small pillow to basically kind of give your low back some extra support if you're having some low back pain when you're driving. Number two, the headrest. In one of my old cars that I had, an old Saturn, if I was to put my head on the headrest like I should, my head was back like this, which was not comfortable for me at all. And if you're trying to have good posture, it should always be comfortable for you, and you should never feel like you're straining. It might feel unusual for you, but it should feel comfortable. One of the things I tell people for their car is make sure the seat is fairly vertical, maybe not completely vertical, but fairly vertical, because that's going to make all of your spinal curves come to an ideal position. Think about trying to find your neutral lumbar spine, try to do that thoracic lift, try to do the neck lift where you're lifting up the back part of your skull to lengthen your neck gently. And what I encourage people to do for postural reminders, once you get into that position, adjust your mirrors. That way, if you're checking your blind spots and kind of checking your rearview mirrors, or you're looking out the mirror on the front window, if you can't see properly, you know you slipped a little bit from that ideal posture, and it's a nice reminder for you. Because sometimes, no matter how good your intentions are, you do need an extra reminder to sit up straight. If you're using a computer all day long, putting a little Post-it note on the frame of the computer, bright colored, annoying colored, something that's going to catch your attention is another little thing that'll help remind you about good posture. If you have a recliner like I do at home, sometimes I find myself laying in the recliner, reclined, which for my spine is fine. I actually respond very well to that. But sometimes when I'm reclined, I'm not using the support from the back of the recliner on my head, and I'm actually holding my head up with my neck muscles. And if you do that for any more than 5 minutes, sometimes the front part of your neck muscles start really getting tight and spasmy, and they don't let up. So one of the easiest things for you to do for yourself is, if you can't comfortably support your neck or head on the recliner if you're laying in one, get a little blanket, little pillow, again, to try to support yourself in as near a perfect postural position as possible, with your neck and back muscles relaxed. And again, in the recliner too, if you don't feel like you have enough back support for your spine and how it's shaped and curved, then use a little pillow or a little blanket for support there as well. One of the other things that sometimes is important is sleeping. Now, if you're coming in for physical therapy or chiropractic care or massage therapy and you are feeling great during the day, but every time you go to bed, you wake up in the morning and you just feel like garbage. Sometimes the bed that you have is either too old or it's not the right bed for you, if it ever was the right bed for you. Sometimes your body kind of ages out of a certain bed. We tend to, it seems like, stiffer beds as we get older. So if that's the case, you may want to consider trying out a different bed. If you're going to consider purchasing a different bed, I highly recommend that you do not get rid of your old mattress before you get the new mattress. That way, in case there's a problem with your new mattress, if they have opted or offered to take that old mattress away from you, now you have to deal with that new mattress and you don't have anything to go back to. Also checking into warranties for beds to make sure that you've maybe got like a 30 or 60 day kind of try it before you're set to keep it sort of kind of trial period is very helpful for most people. Also for sleeping, if you're on your side with a pillow between your knees and possibly another pillow between your arms, this will help take the pressure off your spine as much as is possible. Secondly, if you find that you're throwing your pillows all over the place during the night, possibly you're thrashing around during the night like I do a lot of times, and you can't find your pillows and you're losing sleep because of it, sometimes finding a body pillow, just one long pillow to put between your arms and your legs, is very helpful. I had a body pillow for a while. It worked fairly well, but it wasn't until I threw a second body pillow in the body pillow pillowcase that it was actually thick enough for my body. And once I actually did that, I slept much more comfortably through the night. Depending upon how tight your neck may be during the night, if you're having any neck pain or neck problems, the pillow that you need from day to day may be a little bit different. There's a lot of different pillows out there. I've met some people that spent $200 on a pillow and it didn't make them feel any better with their neck pain. I like to encourage just general, simple pillow things first. So one of the first things you can try, and this is just a standard pillow right here, is taking the pillow and making sure that when you lie on your back or on your side, that it's thick enough for you to keep your head in the same position you would be if you're sitting up with good posture or standing with good posture. If this pillow is underneath my head and I'm lying on this side and my head is tilted down this way, or it's up like this, my neck muscles and my neck joints are going to be very stressed during the night and you're going to wake up usually feeling worse. If you lay on your back and you've got 2 or 3 pillows behind your head and your neck's like this, or maybe you've got too thin of a pillow and your neck is tilted back like this, that's also not going to be comfortable usually when you wake up, and sometimes it's not going to be comfortable during the night for you. So if you've got a pillow that's a little bit too thin, try to find a thicker pillow. If you don't have enough money or you can't afford a different pillow, sometimes what you can try is lay down a towel or 2 underneath your pillow on the bed. That way, it's going to be a little bit higher up, it's going to be a little bit firmer, should be able to support your neck a little bit better. If for whatever reason you've got your head on the pillow, but you've got this gap here for your neck joints are going to kind of want to bow down towards the pillow or kind of sag this way. And if that's going to be the case, your neck joints again will be stressed out. So what you can do is make sure the pillow is underneath your neck, and sometimes you can kind of cram it in there so you can sleep more comfortably. If you sleep with your arm underneath the pillow, many times this puts more pressure on the neck. So I always encourage people to try to find that neutral position with their arms and legs both sandwiched around a pillow like this to try to keep everything the most comfortable for them during the night.